Hey, Dr. Royer here.
And Amy Royer.
We're here in Antigua. This is actually our 5th time that we've been here this year. And everybody's asking, why are the Royers always going to Antigua? And we just wanted to share with you absolutely amazing things that have been going on down here that we are a part of as Royer Neuroscience. So let's get into the interview. Aim, what do you say?
As a Royer Neuroscience family, we think you'll be really interested in some of the cool things we're able to do alongside of this stem cell project.
We wanted to take this time to tell you a little bit about what we've been doing over the last year here in Antigua. We haven't been getting killer tans or surfing, not that that's a problem, but we've been down here working, and we've been working with Dr. Prodromus, who is one of the most amazing physicians that I've ever worked with. His credentials with Princeton and Harvard education and all the work that he's done over the years is just absolutely amazing. And he's really dedicated this time in his life to try to help people with regenerative medicine. And the work that we're doing here is absolutely amazing. But it didn't just happen. It started really with where Royer Neuroscience starts, is in our concierge work. So I had the opportunity, and I have had the opportunity to work with Tony Robbins for a number of years. And about 4 or 5 years ago, Tony and I were doing training, and we'd been in Canada. I usually would travel with him and measure things. And I looked at his brain, and we were looking at his thetas and high betas. And for his age, we could see, he was right about where he should be. And then we met up in Las Vegas about 2 weeks later, and I looked at his EEG, and everything had completely changed. You know, those of you that are listening that are Royer Neuroscience clients, what thetas are and high betas are, and it was like somebody completely transformed those, not just through the work of neurofeedback, but something happened. I said, Tony, what in the world happened? And he said, oh, I forgot to tell you, Doc, I was in Panama and I got stem cell. And I said, tell me more. I want to know about stem cell. And so we started to talk about that, and we started to track that. And he actually wrote about these experiences that we had in his book, Life Force, or I think it's chapter 4. And that got me thinking about our clients. What can we help them with? And so one of the people that came to mind was Kirk Cousins, who we've worked with for since he was at Michigan State. And it was the off season, and Kirk and I said, we got to be taking it up a notch. Well, how are we getting better? We said, let's get stem cell in the off season. So I reached out to Tony and said, where should we go? And he says, you got to see Dr. Prodromus. Dr. Prodromus is doing amazing work down in Antigua because he can use high quality cells down there. He can use high volume cells way outside of what the US is kind of restricting some of this technology. And they're sourced really well. And we wanted to get the best for Kirk. And so we came down here, we both did it together. Absolutely amazing. And since then started sending other people. So when I looked at Kirk's brain, it had changed too. So I started talking to Dr. Prodromus, and I said, hey, we need to be measuring people's brains, not just looking at what they're telling us, but what are their brains telling us? Because I'm seeing changes in the EEG. So Dr. Chad and I committed to really doing pre-measures of people, and particularly the first group we looked at, we said, let's make it a little bit difficult. And so we looked at individuals with autism. And it was amazing what we saw. Typically they have very low thetas and very high betas and a lot of stress. And what we saw in that group of autistic individuals was a significant change in their thetas, their calming mechanisms in their brain, and a significant decrease in high betas. And so this kept us on our journey where for the next couple of years we have re-administered those EEGs, getting baselines. And that brings us up to this last May. Can you share a little bit about what happened there?
Yeah, I was wondering if you wanted to say a little bit about the difference of the stem cells here versus what's happening in the U.S.
Oh, that's a good point.
Because that would be helpful to understand. We're not comparing apples to apples.
Yeah, I think that's a great point, because so many times I'll talk to my clients about, enhancing what we're doing, through different things like infrared and hyperbaric, and I'll say the holy grail of this is stem cell. And, I had stem cell, in Baltimore or down in, Boca Raton or something. I'd be like, it's not the same thing. So it's kind of it's a bigger world than just one type of thing, and that has a lot to do with the quality and the sourcing, where the stem cell comes from. And the FDA puts huge restrictions on this to the point that they're not even the same thing when you're talking about them, the stem cells. And then the other thing is quantity. The quantities are severely limited in the United States, and that's why somebody will use stem cell and they'll have some type of impact, because even at a low quantity, they're impactful. But we're talking about going from thousands to millions, and in the case of exosomes, we're talking about billions and trillions, which make a total difference. It's like going from a baby aspirin to some significant pain medicine. Okay, these are totally different levels of what's happening. So that fast forwards us to May.
Yeah. So then we started coming down here ourselves in May and working together in gathering the data, which allowed us just to be a little bit more cohesive in exactly what we're collecting and what we're telling people, and really started to get some traction as far as understanding more about what Dr. Prodromos is doing and where he's heading. And so exosomes began to be the main thing that they were using, because they are less invasive, less to administer, and getting better responses in the brain-based diagnoses because they cross the blood-brain barrier.
Yeah.
So they're becoming super valuable in some of these super difficult diagnoses like ALS, Parkinsons, some of the tremors, and MS. So we began to start to interact with people that are facing diagnoses where they don't have much to offer in the conventional medicine arena. So these people are already individuals that are digging through the research and searching outside the lines, so to speak.
Okay, we've lost Amy to the clinic. They needed a nurse over there, so they didn't need a neuropsychologist. So she's over there and she's helping them out. So I'll finish up the video. So we've seen all this effect with stem cell. We saw that with Tony, we saw that with Kirk, we've seen that with the autistic population. Last May 2024, we came here and Dr. Prodromos was starting to do clinical trials with a new form of stem cell, exosomes. Exosomes are communication pathways between the neurons in the brain that allow things to communicate, and they can also be transferred across the blood-brain barrier. So he was starting with a small group of Parkinson's patients, and the first night we were here, you could see in the restaurant, we have this big restaurant that we all go to, and 40, 50 patients around, and you could see who the Parkinson's patients were with kind of that mask, sort of end-stage Parkinson's. And the question was, how is this going to impact them? Well, the next day they got the treatment, we saw them all at dinner, was absolutely one of the most amazing things I've ever seen. All of a sudden, the facial expression, the face kind of opening up, a lot of the different tremors and things going away were just striking, and not just for one person, but for each person in the group. And we had brought some Royer neuroscience clients here to get some stem cell, people like Tom and Cecilia and Scott and Adi, and everybody was just amazed at what we saw. And we knew that Dr. Prodromos was onto something with these exosomes. And so that's when Royer Neuroscience said, we need to start getting over there to Antigua, getting here, and assessing these people pre and post exosomes, because if there's something happening, we need to document that. Over the last few years, we're close to 300 EEGs that we've done, but about 200 of them have happened in the last 12 months. And what we've been seeing with these exosomes, particularly we've worked with a lot of different people, but we've really been working on Parkinson's group. We've been working on the ALS group, and we've been working on the dementia group, which includes different forms of dementia like Lewy body dementia, also includes Alzheimer's in there. And so we're looking at those groups pre and post stem cell, and the numbers that we're seeing in EEG changes are striking, statistically significant. In 15 out of 15 Parkinson's patients, we're seeing statistically significant changes to their EEG. How that affects downstream behaviors, sometimes there'll be huge impact for a few weeks and then that might digress some, but we definitely are seeing neurologically changes are happening upstream in the brain. And so now we're looking at number of administrations, the quantity of the exosomes that are being introduced so that we can track this. But we are really on the edge of something absolutely amazing down here in Antigua. And you're part of that as the Royer Neuroscience family, because as you do treatment, you do your training in your home, in your office, wherever you're doing that, that data is the same kind of data that we're looking at here. And it's so helpful to be able to have these different reference points. And we just want you to know that that technology you're using isn't just you, it's on the front edge of medicine, and it's allowing us to see massive changes in some significant groups that have some really debilitating illnesses. And we're excited to keep you informed about what's happening down here. If you'd like to know more, or you have a family member or somebody that you know that you might want to explore exosomes or stem cells, let us know. That's not what this video is about necessarily, but we do know that just like us, you know, my father-in-law, Amy's dad, has Parkinson's, and you know, these disorders impact all of us. And so if you'd like to know more, like to know how you could be involved, we really need some help as we're generating the research, and have developed a nonprofit to try to bring some resources in to help us on the establishment of some really good research protocols. But thanks a lot for watching the video. We're excited about what's happening in Antigua and with Royer Neuroscience. Look forward to updating you again in a few more months.